Hi everyone, it's Dr. PJ. Today we're diving into the treatment that so many people call the ultimate in skin tightening and lifting. The one that's always mentioned right next to Ultherapy, which is Thermage. Today we're gonna break it all down honestly and clearly. What Thermage actually is and why high levels don't always mean better results. And of course, my own tips on how to maximize its effectiveness. Stick with me until the end because this video is really going to help you decide if Thermage is the right treatment for you. Alright, let's get started. As I mentioned in a few of my previous videos, Ultherapy works kind of like a magnifying glass. It sends high-intensity focused ultrasound, which is called HIFU, straight into a single precise focal point. That spot heats up and that's what triggers the lifting effect. Even though the energy is concentrated at one point, the overall result is a firming and upward lifting effect across the face. Now, the second treatment and today's main topic is Thermage, which uses radiofrequency energy. RF works a bit differently. Instead of a pinpoint focus, it creates heat in the deeper layers of the skin, stimulating collagen regeneration. So, Ultherapy and Thermage are based on completely different concepts, and naturally the results they create are also very different. That's why some people see great improvement with Ultherapy alone, while others, especially those with both sagging and poor elasticity, may actually benefit from combining both treatments. Thermage uses a very unique radio frequency, which is 6.87 MHz. To put that into perspective, that means 6.87 million electrical vibration every single second. Pretty wild, right? RF energy is generally divided into two types, monopolar and bipolar systems. Thermage uses the monopolar method. The easiest way to understand monopolar RF is to think about a lightning rod. When lightning strikes, the electrical current travels through the rod and down into the ground. Thermage works in a similar way. We place a grounding pad on the patient's body, and when the RF energy is delivered, it flows toward that pad and then completes the circuit back to the device. Because the energy has to connect to that grounding point, monopolar RF requires proper grounding, and that's exactly why it can penetrate much deeper into the tissue compared to the bipolar systems. I get so many questions about treatment levels. Most people assume higher levels must mean better results, right? But that's actually not true. And here's why. Everyone's skin resistance is different. Some people feel intense heat even at level 1 and say, wow, that's really hot. But others can go up to level 3 and still say, I don't feel anything. So the level itself doesn't hold much meaning. What really matters is this. When you're getting the treatment, you should feel a mild, tolerable warmth, not zero sensation. Because if there's no heat, you're not stimulating collagen at all. Some heat is essential for collagen remodeling to happen, but too much heat can actually damage the tissue. Think of it like a burn. If the heat is excessive, it can denature collagen in a bad way and even cause scarring. So the goal is that sweet spot. Warm enough to trigger collagen production, but never so hot that it harms the skin. With Thermage and other RF treatments, we usually talk about 600 shots, 900 shots, things like that. When we talk about shots, it basically means we're delivering many repeated pulses at lower energy. Thermage doesn't blast the skin with one big burst of intense heat. Instead, it works by delivering multiple lower temperature pulses over and over again. And the key thing is this. You should feel those pulses. During Thermage, feeling a moderate heat and a bit of discomfort is completely normal. That sensation means the energy is actually doing its job. For Thermage, it's actually helpful if patients can feel how warm each pulse is during the procedure. That's why I generally recommend doing the treatment with just numbing cream, so you can still sense the heat level and give feedback. But of course, some people are very sensitive to pain. In that case, you can choose to get light sedation, but we would lower the treatment level to keep things safe. Another option, especially for those who are sensitive but don't want full sedation, is to combine numbing cream with the laughing gas, which can make the treatment much more comfortable while still allowing you to feel enough heat for effective results. There's one thing you shouldn't misunderstand about Thermage. It's not a treatment that adds volume to the face. That's not what it's designed to do. The main effect of Thermage comes from collagen regeneration, which improves the skin elasticity and overall firmness. And because the radio frequency reaches deep enough to affect the fat layer, it also passes through the membrane that surrounds each fat cell. When that membrane contracts, the overall volume of the fat cells can slightly decrease, and the tissue in that area becomes a bit tighter and more toned. So instead of giving you dramatic instant changes, Thermage creates this subtle but noticeable improvement. Your skin feels firmer, tighter, and more put together. It's not a wow, my whole face changed overnight kind of result. It's more like, my skin feels tighter. Everything looks a bit cleaner and more lifted. That is the true signature of Thermage. For people whose skin has very low elasticity, the kind of skin that's already weakened and lacking firmness, Thermage alone usually doesn't create a dramatic improvement. Their skin simply doesn't have enough strength to respond the way we want. That's why these days we almost always start with Juvelook before doing Thermage. Juvelook helps the upper layers of the skin produce more collagen and also gives a subtle volumizing effect. It basically builds strengthening the skin. When your skin is already stronger and more resilient, and then you add Thermage on top, the RF energy boosts everything even further, giving you much tighter, firmer, more elastic skin. So the ideal approach for certain patients is Juvelook first and then Thermage. Doing them together not only enhances the result, but can also help the effect to last longer. When it comes to treatment interval, most people start to feel the effect drop off pretty noticeably after about 6 months. That's why I usually recommend repeating Thermage somewhere between 6 to 9 months. And in the past, we used to think 600 shots were enough. But after seeing real results over the years, one thing became very clear. The more shots you get, the better and longer lasting the result. If you increase the shot count, for example up to 900 shots, the improvement tends to last much longer, sometimes even 9 months to a full year. So, doing a higher shot count in one session often gives you both stronger and more durable results. We also do a lot of eye thermage for that area around the eyes. The tip used for the eye area is much smaller, and because the skin here is very thin and sensitive, the energy can go deep. So we use very low energy but with high repetition, usually around 550 shots. However, because the energy has to stay gentle, people with significant eyelid or under eye sagging might not see dramatic results after just one session. In those cases, I usually recommend doing 2 to 3 sessions spaced about 3 months apart. Once the elasticity around the eyes has improved to a certain level, you can maintain the result by repeating eye thermage every 6 months. The most important thing to understand is this: Thermage isn't a one-size-fits-all treatment like everyone must get 600 shots. That's not how it works. You need a proper diagnosis of your skin condition, your elasticity, and even your face structure to decide the right shot count and energy level for you. And because Thermage isn't a cheap procedure, it's really worth knowing what it does and how to get the best possible results from it. Instead of expecting dramatic changes from a single session, think of it more like a steadily saving up collagen in your skin, building it little by little so your firmness improves and stays stronger over time. If today's video helped you, don't forget to like, subscribe, and turn on notifications. This is Dr. PJ. Thanks for watching.